Hi guys, welcome back to Live Well with Dr. Mel. I'm Dr. Mel, licensed physical therapist and holistic health coach. If you haven't yet subscribed to my channel, go ahead and click that subscribe button. In this video, we're going to go over simple exercises and stretches that are going to help with your shin splints. And you can use just simple things around the house. I'm not going to have any fancy physical therapy equipment in this video. You're just going to need either a lacrosse ball or a tennis ball, a can of soup, yoga strap. If you don't have a yoga strap, you can just use a dog leash or even your dad or brother's pants belt. So if you grabbed what you need and you're ready, let's get started. So the first thing to understand when you have shin splints, it usually is an overuse kind of injury. So you may have started a new exercise program and you're doing a lot of work, a lot of weight-bearing activity. So it's really important to schedule in some rest days where you're stretching or doing some cross training where you're not constantly on your feet, either running or aerobic exercise or doing pounding on your feet. Instead, work in some days where you're doing biking, swimming, rowing, something non-weight bearing, and stretching. Yoga is great as well. Also do these exercises, these stretches on your off days as well. The first one, for people who are really in the acute inflammation phase, that first 2 weeks, you want to point your toes, really feel that stretch on the front of the shins there. For stretches, you want to hold longer, prolonged holds for at least 30 seconds. If you have more time, holding the stretch for either a minute, 2 minutes, 3 minutes, even 5 minutes if you can. The longer you hold, the better. And you'll notice as you sit here and hold here, you can go further and further, and it's not so intense as it was when you initially started. If this is really easy, then you can advance to the next exercise. You can go onto all fours and begin to sit back onto your heels. It may be intense for you right here, but eventually you want to be able to sit completely on your heels. If you can tolerate this, just sit here for 3 to 5 minutes. You'll get a nice stretch on the front of the shins here. If this is pretty easy for you and it's more of a chronic shin splint injury and you're doing this just as a preventative, you can advance by lifting your knees up. You get even more of a stretch here in the front of that anterior tibialis muscle, the muscle that is responsible for shin splints. It's also good to massage that muscle out. So you can either do that just using your fingers, running them up and down along the outside of your tibia so you feel this bony prominence right in the middle of your shin bone. That's your tibia. The muscle, the anterior tibialis, attaches on the outside of that. So you just want to go up and down the muscle belly here. You can also foam roll it, but if you don't have a foam roller at home, a can of soup works just as well. That's why I tell a lot of my patients, because some of them don't have a foam roller at home. So I tell them just grab a can of soup, put it right below your knee, and then you just roll it up and down, bringing your knee forwards and backwards. You do it, run it up and down nice and slowly at first, and then you may feel a spot where it feels really intense. Then you isolate over that area and do some small rolls just right on that area. Then once that intense spot releases, then you find a new one. So if you have a point that was really tender and you want to do a trigger point release, you can grab the lacrosse ball or either a tennis ball, place it right on the spot that was really tender, and then you're just going to lean into it. Put good amount of pressure into it, and then you're just going to hold it there for 30 seconds. And you'll realize as you go, you can put a little bit more pressure as it begins to release. You can do this on any spot that's bothering you. It could be multiple spots. Also, it's really important to do the same thing on the back of your calf, because that area can get really tight as well, and the calf and the anterior tibialis work together. So when you're running, it could be the calf that's part of the issue as well. If you're not flexible enough in the calf, the anterior tibialis is going to do more work than it needs to. So let's roll out that calf muscle as well using that can of soup. First, you do a long roll all the way down from the bottom of your Achilles all the way up to the top of your knee. You can press up onto your hands to allow yourself to roll a little bit easier. Once you find that spot that's bothering you the most, that bumpy spot along the road, you stay right on that area for a little bit. And if you want to go a little deeper, you can use the lacrosse ball or the tennis ball again and really get a trigger point release right on that area. Also, you can a simple stretch with the yoga strap, or you can use your dad or brother's belt. Place it around the ball of your foot. Hold the ball of your foot towards you by pressing the heel away, flexing the ankle, keeping your knee nice and straight, and you get a good calf stretch here. And let's hold it here for at least 30 seconds. Good job. If it's difficult for you to get on and off the floor, I have some patients who, after a knee replacement or a hip replacement, they're getting really tight in their shins or getting some shin splints because they're starting a new exercise program. So a modification is using the chair, placing the top of your foot on the chair. If you need to balance, you can grab the kitchen sink, do this in front of the kitchen sink or a banister or a railing, and then just press down into the top of your foot. You get a nice stretch on the front of the shin there. Same thing, you try to hold it for at least 30 seconds. If you like the content that I shared today, go ahead and give me a like, as well as comment on the bottom of the video. I love reading your comments, or even send me an email if you have any other questions or concerns. Feel free to share the video with all your friends and family, anybody you think would benefit. As always, stay healthy, be well, and take care.